Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy. So mainly we are going to continue the session series related to the planes of the body. In our previous session, we talked about the two types of planes, sagittal plane and frontal and coronal plane. Now we are going to talk about the third plane, that is transverse or horizontal plane. Okay. So in this session we will discuss each and everything about transverse and horizontal plane. We'll start from the definition, then I'll walk you through some of the examples and how it is utilized in medical coding, and along with that we will also discuss some of the important points and questions that will come in your interviews or examination. Okay, so by the end of this session you will be able to understand what exactly the transverse horizontal plane. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because for time being, we are just mainly focusing on what is transverse horizontal plane. But prior to that, you should know about what are body planes, what is sagittal body plane, and what is frontal or coronal body plane, because they all are connected with each other, right? Okay, and for that you can also refer the Sharmit digital course book, which is freely available in the description box. There you will find thousands of sessions available in both Hindi as well as English language. So without any language barrier, you can consume the content, and in case if you have any questions related to that, feel free to reach out to me so that I can try my best to answer your questions. Okay. Alright, so let's get started. Here you can see we have transverse and horizontal plane. This is the diagram that you should remember while we will go through the documents, the notes. You should know about, you should at least visualize this image. Okay, so what is this? Like, this is an imaginary slice that we are passing through the body horizontally, and that's why we are calling it as transverse or horizontal plane. Okay, now see the definition. The definition says the transverse plane, also called as the horizontal plane or axial plane, is a horizontal plane that runs side to side and front to back across the body, dividing it into superior, that is upper, and inferior, that is lower portion. Okay, so basically it divides the body in two portions, superior portion and inferior portion, that is upper and lower. Now those who have already know about the directional term, they know what is the meaning of superior, what is the meaning of inferior, right? That's why we were talking about the sequence, importance of learning these in sequence. Okay, now you can see here is one word, that is origin of the word, right? So let's see how this word came into the picture, the transverse, horizontal or axial. The first word says transverse. The term transverse comes from the Latin word transversus, meaning lying across. This referred to the fact that this plane lies across the body horizontally, cutting straight across from one side to another. Okay, then we have horizontal. That means the term horizontal simply describes that flat level direction of this plane, like the horizon line. It runs perfectly flat and level across the body, parallel to the ground. Okay, likewise, if you look at the definition for axial, you will find that the term axial refers to the axis of the body, the central vertical axis running from head to toe. That means a cut made perpendicular to this central axis produces the axial transverse plane. Okay, so in medical coding, the term axial is most commonly used name for this plane. Okay, now you can say that all three names like transverse, horizontal, axial refer to the exactly same plane and are completely interchangeable. In medical imaging, CT, MRI, axial is most commonly used term. In general anatomy, transverse is most commonly used term. Okay, so sometime in interviews they might ask you like, are there three different type of planes? No, they are not different type of the plane. They are all same and can be used interchangeably. But in medical imaging, mostly people use the term axial, and in general anatomy, transverse is most commonly used. Okay, so depending on the context it is utilized, but yes, it is not the different or unique. Okay, now the next thing is, what does the transverse plane divide into, how it divides the thing. Okay, so the transverse plane divides the body into two parts. One is superior or upper portion, everything above the cut, and one is the inferior lower portion, everything below the cut. So if you look at the example again, diagram again, so you can see it is cutting from here. So this is superior and this is inferior portion. Okay, so this is the one thing. Now second thing says the division relate directly to the directional terms superior and inferior. This is the direct link between the transverse plane and the superior inferior directional relationship. Now we have direction of the transverse plane. To clearly understand the direction of the plane, it runs horizontally, perfectly flat and level parallel to the ground. It runs side to side, from the left side of the body to the right side. It also runs front to back, from interior surface to posterior surface. It does not run vertically. Both sagittal and frontal plane are vertical. Very important line, because in interviews they might ask you like, is it vertical or horizontal? So you have to simply say that transverse is the only plane that is horizontal. Other than that, sagittal and frontal, they are vertical. Okay, so you can imagine a flat tabletop passing through the body at the waist level. That flat surface represents the transverse plane. Okay, now we have key feature, infinite transverse plane. So an extremely important concept about the transverse plane is there is an infinite number of transverse plane that can pass through the body, one at every possible height and level. Okay, so it doesn't mean that we have only one plane. Like if you want to examine something near knee, so you will pass it from here. If something near chest, you can pass it from here, because this is just an imaginary line, right? So it could be infinite. Unlike mid-sagittal plane, which has only one specific central location. We all know that mid-sagittal has only one specific location. Other than that, we have parasagittal that can be used, but for mid-sagittal we have only one specific location, right? But in case of transverse plane, it can be drawn at any level of the body. Fine. So we can say that a transverse plane through the head cut through the brain, a transverse plane through the neck cuts through the cervical, vertebral, trachea and esophagus, a transverse plane through the chest cuts through the heart, lung and ribs, a transverse plane through the abdomen cuts through the stomach, liver, kidneys, a transverse plane through the pelvis cuts through the bladder, uterus, prostate and pelvic bone, a transverse plane through the thigh cuts the femur and thigh muscle. Okay, so this is exactly how the CT and MRI work. They produce a series of many transverse axial slices at different level from top to bottom of the body, like slicing a loaf of the bread into the individual slices. I think these all things are clear. Now relationship between transverse plane and directional term is quite simple, like superior toward the upper portion, inferior toward the lower portion. Okay, so next thing is, let's compare all, because till here with this session we are done with all types of planes. So let's compare it one by one. So here in the first column I have noted down the features like orientation, direction of cut, divides body into, related directional term, view, produce, also called a number of plane. So one by one we will check all these differences. On second column we have sagittal plane, third column we have frontal plane, and fourth column we have transverse plane. Okay, so orientation, vertical, horizontal. Here we have direction of cut from front to back, side to side, across the body. Here divides body into right and left. It divides in anterior and posterior, that means front and back. And here superior and inferior, that means top and bottom. Okay, it is related to medial and lateral, it is related to anterior and posterior, and it is related to superior and inferior. Now this one provides us the side view, this one provides us front or back view, and it provides us top or bottom view. It is also called as median plane if midline, it is coronal plane, it is axial or horizontal plane. If we talk about number of planes, it's infinite, one midline, mid-sagittal. So in case of mid-sagittal, only one midline. Okay, so I think now you have all the understanding of these plane. Now I'll quickly walk you through some of the portion like structure viewed at different transverse level. Because the transfer level plane can be drawn at any level, different structure are depending on where the cut is made. So I'll just show you some example. Okay, so transfer cut through the head brain level like cerebral hemisphere, lateral ventricles, basal ganglia and thalamus, white matter and gray matter. Transfer cut through the neck, cervical vertebrae, trachea, esophagus, carotid arteries, jugular veins and thyroid gland. Then we have transverse cut through the chest, heart, right and left lung and aorta. So this is how we can assume the structures that are viewed at different levels of the transverse plane. Now we have learned so many things, so we should also know about the medical coding, right? So you can see here in medical term how it is utilized, like axial CT scan, which means a CT scan taken in the transverse horizontal plane, the standard CT acquisition. Axial MRI, an MRI taken in the transverse plane. Transverse fracture, a bone fracture where the break line runs horizontally across the bone. Transverse colon, the horizontal portion of the large intestine crossing the upper abdomen. Then we have financial incision, a horizontal surgical incision above the pubic bone used in C-section. Then transverse cervical incision, a horizontal neck incision used in thyroid surgery. Then we have axial plane deformity, a rotational deformity occurring in the transverse plane. And then we have cross sectional imaging, another term for imaging in the transverse axial plane. So these are some examples for medical coding. Now I'll just give you quickly a trick to remember all these concepts. So transfer means lying across, which is horizontal, divides the body into top and bottom. Clear? So you can think of this way, like imagine a slicing of loaf of bread. Each individual slice is transverse axial cut. The slice run perfectly flat horizontal across the loaf. Everything above the slice is superior and everything below the slice is inferior. Okay, so transfer is like the horizon line, perfectly flat and level. The horizon is always horizontal and the transfer plane is always horizontal too. So every time you see a CT scan image showing a round cross section of the body, that is the axial transfer image. Clear? So yeah, I think now we are good with this session. We have covered everything related to transfer axial plane. Now there is one question for all of you, and today's question is, what is the direction of what is the direction of cut in frontal or coronal plane? Okay, so I'm sure you already know the answer of this question, so please do share your knowledge in the comment section so that others can take a reference from it, because once you share the answer, it will help others to directly look the answer in the comment section if someone is not aware of it. Also, when you start sharing your knowledge here in the comment, it will instruct me that you are learning from these sessions, and accordingly I will release the more and more session related to this playlist. Clear? So please do share, and those who are sharing it consistently, we will also feature that person in upcoming sessions maybe. So yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.